I enjoyed listening to all of them. They all brought a different perspective to what is a complicated area of activity. I hadn't really appreciated the balance between the different sorts of activities that the agency get into that Dominic set out very clearly in his presentation.
It was a good speech. He did say what I wanted to hear, which was that diversion teams would be rolled out across the country. I also quite liked that he was, it was an honest, clear speech, and he did apologise for people working in the public sector for the cuts at the moment, and I think that that's probably a good thing to say.
I realise that many of you are deeply and personally affected by the reductions in public spending that are going on at the moment. And I just want to say that I'm sorry about that, genuinely sorry about that. I understand personally how much of an impact that has on people's lives.
The Paul Hanlon Foundation funds Revolving Doors, and recently joining the foundation I've only just getting to know about Revolving Doors, but with the limited knowledge I have, I now know about the kind of regional structure and the level of close working with partners on the ground and the link worker model and the kind of openness and self-learning and self-reflection of the organisation. So the critical agnosticism, I think, was the term.
Well, there are far too many people who are in the criminal justice system today with undiagnosed mental health and learning disability problems. And we need to deal with this. If we're to reduce the prison population, we need to start right at the very beginning. We need to be talking to people as soon as they arrive in the custody suite. And a good court diversion system would quickly identify people with LD particularly and start to have a system in place where we can divert these people to. The NHS has a responsibility for every citizen in this country, irrespective of the position they find themselves in at that time. We shouldn't discriminate against people simply because they're in the criminal justice system. If they have a health need, if they have a need around mental health or LD, the NHS must step up and deal with that.
The power and the inspiration that service users experience gives can never be underestimated.
I'm absolutely certain that when you're designing services for people who have suffered from mental health or learning disability problems, who have found themselves in the criminal justice system, hearing their stories is absolutely crucial in understanding what the real problems are, what the real barriers for change are, and what real services are required to meet those individual needs.
I learned that involving service users is really, really important. It's absolutely critical because actually what it is, what you're showing is what Revolving Doors does. So you're doing what it says on the tin. And I think very often people play lip service to working with their service users. And I think what you're doing is setting an example throughout the UK about how charities and the statutory sector should be working much more closely with the service users and hearing their voice.
I've been in and out of jail for the past, I think it's about 13 years. I've spent a total of 8 years behind a prison door.
I was fleeing domestic violence with my son, and then we was on the streets. We both had a drug habit of heroin. I got caught shoplifting. They put me in prison.
Started off sniffing glue, gas, petrol. It just led on to drugs. An 8-9 years addiction. I managed to come off drugs, just swapped it for alcohol, and the last 10-12 years has just been alcohol and prison.
I've worked for 20 years in mental health services myself, and you're not going to deliver effective services to service users unless you listen to them, and that goes right from the practitioner level on the ground to policymakers and particularly commissioners.
Well, these days they just send you to prison for petty things instead of giving you the help. And because most of the bail hostels are only from like 16 to 25, I was over the age. So I had no choice to go to prison.
I think using that sort of medium on a day like today is hugely, hugely important. And I was really heartened by Sir Keith Pearson's endorsement of doing that, and him saying that you know this should be upfront on your website and people seeing this.
When I was writing my report for the previous government, which is now being implemented by the current government, I was determined that the voice of the users and the carers of those users was heard very loudly in the recommendations I made. And as we implement those recommendations, it is equally important that the voice continues to be heard to ensure that we're designing services that meet often very complex needs of the individual, rather than assuming that the statutory services or other people working in the system fully appreciate all the needs that need to be addressed and met.
I should have to say that I've seen quite a lot of films in my time, and what was really impressed was the quality of the work. Beautifully edited, beautifully capturing the stories, very distilled down, and highly effective.
The only way really getting the message across to people is to be there yourself and actually know what it's like to go through an addiction.
If you don't have users involved in developing services and in an equal relationship in planning and delivery, then it's always going to fail.